As we age, sexual health remains an important aspect of overall well-being, yet it often goes unspoken. And today we have Andrea Spencer, Director of Clinical Services at Metro Health, joining us to discuss the significance of STD and STI awareness in the senior citizen community. Andrea, thank you for being with us today.
Absolutely. Good morning.
So what are some of the common misconceptions about STDs, STIs among older adults, and why is it important for us to address these misconceptions?
So the misconception is that as we age, we don't have to worry about protecting ourselves. We don't have to worry about getting STDs or STIs because we think that's only for the younger population. But on the contrary, since we are now living longer, divorce rates are going up. Now, we have these dating apps. As older adults now, we feel the need to explore, and we are having, sexual activity and are not protecting ourselves. So the misconception is that we can't get it, but we can.
Yeah, and the addition of erectile dysfunction medications
Absolutely has given us the vigor that we think that we are young again and we can do all these things, and and STDs doesn't apply to us, but it does.
What are some of the symptoms that seniors should look out for when it comes to STDs? And if they do have those symptoms, what should they do about it?
So definitely first, we need to protect ourselves. Men and women both need to make sure that they're protecting themselves. So how do we do that? Of course, with the use of condoms if you're having more than one sexual partner. Now, what are some of the symptoms? Some of the symptoms can be discharge in color, variations for both men and women. Also, swelling of the genital area, maybe painful urination, maybe rash, some alterations of your genital area that you have not seen before. Now, when this occurs, you need to speak to your healthcare provider. Speak to your doctor about it. Let them know what the symptoms are. Write them down so that you don't forget anything, and then follow through with the treatment.
How can seniors foster more open communication with sexual partners or potential sexual partners about their sexual health?
Well, looking at your sexual health as you would any other health condition. The same way that we speak about high blood pressure and diabetes and other things that are concerning us. Our sexual health is a topic of communication that we should be able to have openly with a partner that we are planning on engaging with, because of course we want to make sure that we are taking good care of our health. The same way that we take high blood pressure medication to monitor our blood pressure and make sure that our blood pressure is okay, we also want to make sure that with our sexual activity that we're taking good care like we did when we were younger. Making sure that we have that comfortable conversation, be open, be candid, be honest. And then of course with our providers, speak to our providers about what our intentions are, what are our expectations, what do we want to do. And if we are thinking of having sexual activity with multiple partners, finding out what is it that we need to do and how can we protect ourselves. And if something should occur that has caused some discomfort, what treatments may be available.
What resources would you recommend for seniors who are interested in learning more about STDs, STIs, as well as how to have safer sex practices?
So, well, AARP has something online about sexual health. You have the Department of CDC also has a section on sexual activity, sexual health, sexual protection, Planned Parenthood. It's not only for younger adults, it's also for the age. They're able to see, depending on, their sexual activity, what can be done, what resources are available. They have free condoms available if, cost is, an issue. You also want to look at the American, they have the ASHA, which also talks about American Sexual, Disease Association. So there are various resources, and of course, speak to your provider, your healthcare provider. They may also have some, some brochures or some pamphlets that may be available for us as seniors, or older adults to definitely help you identify any issues that you may have with any sexual activity.
Yeah, your sexual health care is part of your health care.
Is a part of your healthcare. Absolutely. Yes.
Andrea, thank you so much for being with us.
And you're so welcome.
And if you'd like to connect with Andrea, you can reach her by phone at 407-712-6395.